My name is Saskia Osendorp and I work as Senior Strategic Advisor for the Micronutrient Initiative. That's an organization that has its headquarters in Canada, but it has as its mission to improve micronutrient nutrition in vulnerable groups in low and middle income countries, so in mothers of childbearing age and in young children under the age of 5. I did studies in Bangladesh on zinc supplementation during pregnancy and infancy. And I went there for the first time in 1994, and when I came there, child mortality rate was very high, like in many low-income countries. And a predominant cause of child mortality, or the under 5 mortality, was diarrhea, and still is diarrhea. Diarrhea in children is a main killer because it dehydrates children, so children have less fluids. And because of this dehydration, that's their main cause of dying from diarrhea. But in addition to that, during a course of diarrhea, children are less able to absorb nutrients from their food. And in addition, they lose a lot of nutrients through their gut. So they have, on the one hand, a higher risk of losing nutrients, and they cannot absorb nutrients during the course of diarrhea, which means that they get retarded in their growth. And that's the case with many infectious diseases, but in particularly with diarrheal disease. Traditionally, mothers in many low-income countries, they don't do anything when a child has diarrhea because they consider this as a normal thing to happen to children, so they don't seek care. So an important component of programs for the management of diarrhea now is to educate mothers that they have to seek care quicker when their child has a course of diarrhea, and in particularly when there is a situation of bloody diarrhea, because that is a sign of severe disease. And in addition to that, when mothers are going to seek for care, they are often requesting treatment with antibiotics. And many professionals, health doctors and nurses in developing countries also provide antibiotics to children when they have diarrhea. Whereas now the official recommendation by the World Health Organization is that if children have a course of diarrhea, they should be receiving ORS to prevent them from dehydration, and a course of zinc tablets for 2 weeks, because zinc is also considered to be important for the treatment of diarrhea. Antibiotics can be provided when a child has diarrhea, but the problem is that in many cases diarrhea is caused by other means, not by a bacteria, but for instance by a virus. So if antibiotics is being given to all children with diarrhea, it will not be effective in all cases. Whereas at the same time, it also doesn't prevent dehydration in the child. So if the child is not receiving ORS, it will still die from dehydration during the course of diarrhea. And that's why all children with diarrhea should be receiving zinc and ORS, whereas antibiotics should be provided only when it has been tested that the cause of diarrhea is a bacteria. It's better to give ORS, or oral rehydration solution, and zinc during a course of diarrhea because dehydration is the main cause of death from diarrhea, and all children who have diarrhea develop a stage of dehydration. Antibiotics, on the other hand, are important when the main cause of diarrhea is by a bacterial cause, but that's not always the case. So in many cases, the diarrhea is caused by a virus or by other pathogens, and then the antibiotics doesn't do anything. So not all children with diarrhea need antibiotics to treat the diarrhea. In my studies in Bangladesh, we provided pregnant women with daily zinc supplements from the 2nd trimester of pregnancy until delivery. And we followed their children, the babies that were born out of these women, from delivery to 6 months of age. And what we found was the babies of mothers who received zinc supplements, they didn't have a higher birth weight, and they also didn't have any differences in their growth or in the morbidity from infectious diseases during the first 6 months of life. However, the babies that were born with a low birth weight, that is a birth weight of less than 2,500 grams, of mothers who were provided with zinc during pregnancy, they had fewer episodes of diarrhea and of respiratory infections during the first 6 months of life. And that was an important finding because usually these babies who are born with low birth weight are at higher risk of having an increased morbidity. So providing zinc supplementation during pregnancy helped these babies to reduce the disadvantaged health risk that they normally would have had. Yes, these findings are confirmed by other studies to some extent. And also there have been studies that have demonstrated that if you provide zinc during infancy, so to infants in the first 6 months of life, you reduce and you prevent diarrhea from happening. So zinc plays an important role also in the prevention of diarrhea in children. There's two ways that zinc can be provided. It can be provided as the treatment for diarrhea, and it can be provided to prevent diarrhea from happening. Now, for the treatment of diarrhea, the World Health Organization has said there is sufficient evidence now to recommend zinc along with ORS for the management, the treatment of diarrhea. For the prevention of diarrhea, the evidence in children, the evidence base is also accumulating. For prevention of diarrhea in children whose mothers had been supplemented with zinc, so basically to provide pregnant women with zinc for to prevent diarrhea in their children, there the evidence base is not yet sufficiently established. The difference that it has made is that at the moment there is a guideline from the World Health Organization to include zinc in the official treatment of diarrhea, and more countries now are introducing this guideline in their official protocols for the management of diarrhea. So there's more and more programs now who are focusing on providing zinc along with ORS for management of diarrhea. For the prevention of diarrhea in children, I think there is enough evidence now to say it's important that children get sufficient zinc to prevent them from having zinc deficiency. And normally what you see now is that organizations say, well, it's not only about zinc, it's also about other micronutrients, so ideally this zinc should be provided in the context of a multiple micronutrient intervention. So to improve zinc nutrition in children, definitely there is a lot of evidence now that it is important to prevent them from falling sick with diarrhea. You can improve zinc nutrition like all micronutrients in a variety of ways. So supplementation is definitely an important intervention to improve zinc intakes in children. But in addition to that, you can improve dietary diversity, and in particularly foods that are rich, foods from animal origin are rich in zinc. So if we can make children consume more foods of animal origin, meat, milk, fish, then their zinc intake will improve. And zinc fortification, so the fortification of foods with zinc, or biofortification of foods with zinc, is another important intervention that we can apply to improve zinc nutrition in low-income countries. I first went to Bangladesh 20 years ago, and if I go back to the country now, I see a country where definitely child mortality has been reduced, and also child nutrition has improved. So the percentage of children in Bangladesh under the age of 5 that are stunted, so that are too short for their age, has been reduced. And I think from all the low-income countries, Bangladesh is a real example of a country that has making great progress. One of the reasons is that they have been able to reduce the mortality from infectious diseases. They have been very successful in scaling up the treatment of diarrhea with zinc. There was a large program in Bangladesh called the SUSI program, Scaling Up Zinc program, where they, which was scaled up throughout the country, in which children with diarrhea were being provided with zinc in addition to ORS. Having said that, still 40% of all children under 5 in Bangladesh is currently stunted, so there's still a lot to do, also for a country like Bangladesh. But a lot has been achieved already.